Hello everyone, my name is Yuliia Shyn. I'm one of the trainers at Driven Properties, and this is the video guide for you to learn how to provide psychological first aid. In this video, you will learn what is psychological first aid, how to identify and respond accordingly to different types of stress reactions, and what are the foundational rules and ethics of providing psychological first aid. Before you begin to provide the psychological first aid, it is important to monitor your inner level of resource as often as possible. You can do it by asking yourself a question: what's my level of inner resource today on a scale of 1 to 10? If you fall on a lower scale of the inner resource, that's absolutely okay. It just means that it is recommended that you delegate providing psychological first aid to someone else. What is psychological first aid? It is the set of actions that you can take immediately in order to provide the support to an individual who is experiencing an acute distress or extreme stress response to a crisis. It typically occurs, such a response, immediately after a traumatic event, and that is immediately you take actions to provide this psychological first aid, and the goal is to stabilize emotionally those individuals who are experiencing such an extreme stress response to a crisis, and the goal is also to help the person feel safe, calm, and connected, get back to their inner resources. Who can provide psychological first aid? First of all, the trained professionals, those like teachers, first responders, and healthcare staff. However, there is no requirement for having psychological or clinical background. Volunteers and you yourself can get trained to practice providing psychological first aid. Because it is the idea is just to stabilize the person emotionally immediately. Unlike the psychological crisis intervention, so after the first psychological aid is provided, then there will be already the role of the clinical professional to provide the crisis intervention, and it is a structured approach, a program or a protocol, more long term, to help a person who is facing such a distress, post crisis or post traumatic event, to prevent the long term harm on their psychological and physical system. So the idea is to restore their function, full function, like before the traumatic event. And who can provide the psychological crisis intervention? Mental health professionals like psychologists, counselors, and therapists. Who might need the psychological first aid? So it's related not only to adults and children who experience this traumatic event, but those who were injured in those events. Both adults and children, and as well as professionals who served or currently serving in some events that might be traumatic. For example, someone is serving firefighters during the natural disasters, rescue staff, healthcare professionals, as well as volunteers. What are the areas that first psychological aid is focusing on? First of all, the emotional state of an individual, and second is the behavior. What do we mean by emotional state? So it is the state of neuropsychological or emotional tension that the person is experiencing within. And for example, of emotional states are preoccupation, feeling fatigue or brain fog as well, experiencing depression, dissatisfaction, melancholy, similar to apathy, as well as there are some of the emotional states due to extreme fear. Those are anxiety, insecurity, nervousness, worry. And as well as through psychological first aid, we address behavior. It is a set of action that an individual may expose due to response on the crisis, on a traumatic event, and such actions could be aggression, crying, hysteria, and shock. And we are going to review what actions you can take to address such behaviors. So, what are the psychological first aid protocols? We first begin with reviewing the ethics. The fundamental ethics are, first of all, you need to be honest about what has just happened, about the event, and who you are. Secondly, respect the perspectives of others and being unbiased. So avoid jumping into assumptions about what the person might be thinking, experiencing, whether it's right or wrong. And we respect the cultural background and individual background and our differences as well. We do not offer material reward in order to reinforce specific reactions. For example, we do not offer taking a person for food, to lunch, buying something for a person in order to motivate them to calm down. We do not promise what we can't guarantee. And for example, we do not tell that everything will be okay. So the nothing will happen, nothing bad will happen. So we can't guarantee, so we can't promise it, and do not offer help if the person is resisting. So we do not force helping or supporting a person. And sometimes what you can do is just sit down with the person just in silence. Sometimes it is already the support that they need. And you can also explain that that's okay. Whenever you are ready, I'm here with you, I'm here for you. Whenever you are ready, we can address it. So, one of the emotional states that you might face and which will require the psychological first aid actions is the fear. It is important to highlight here that the moderate level of fear doesn't require the psychological first aid. It's absolutely normal and healthy to have some level of fear. However, psychological first aid is required when the individual is experiencing the extremely high level of fear. And you can recognize it by observing that their muscles in hands, in wrists, in jaw, facial muscles will be tense. Sometimes I observe that the individual may have a shaken muscle over here between the eyebrows. As well as their heartbeat will be racing, and you might identify it by trying their pulse, and additionally that the person will be having a short breath like after running. You might observe this type of breathing, and additionally the may share that they feel helpless and they don't know what to do, kind of feeling lost as well. And you can observe that the person is not being able to compose themselves. What to avoid doing if you observe the extreme level of fear? First of all, do not mock the person, trying to bring a humor here. It's irrelevant. Calling them coward, trying to joke, right? So try to avoid that. It won't help. And address fear only, once again, when it is on extreme level. What you can do instead is, first of all, take the the person's hand and place them on your wrists, right where where your pulse is, so they can feel your pulse. It will indicate them that you are there, you're with them, and they are not alone. Secondly, breathe deeply and slowly. And encourage them to join and match your breath and match your rhythm. Next, if the person starts talking, just listen and demonstrate that you are hearing them. So you can nod, you can say, yes, I see. So demonstrate that you are listening them. You can also gently massage their muscles where they are tensed, for example, in their body, in the shoulders, wrists can be tensed a lot, and as well the jawline or here the forehead, whenever you observe the tension in their muscles. And if culturally it's might be not acceptable, then you can just ask them, give them quick instruction, do as I do. So you put the finger on the wrists so that you can feel your pulse. You make deep breath and tell them that breathe with me. Okay. The next emotional state that you might face and require the psychological first aid is numbness. So the person is numb. It's a complete absence of any movement, of any speech. The person is just frozen, and the person is not reacting to any noise, any light, any touch. So you will see that the person is frozen in one posture, is not moving. This is numbness. And what to avoid: do not leave the person without assistance. Do not leave them alone in such a state that the person is helpless and they can't take care of themselves, and they might be endangered depending on the situation, the context, and the environment. Do not leave the person alone, because if it is outdoors, for example, the person won't be able to run away from danger. Instead, what you need to do, so bend the person's wrists and fingers like that, and in a knuckle, and then press those fingers in their palm. Press. Then, using the tips of your thumb and index finger, you can massage their forehead over here. So you can touch the points between the hairline and the eyebrows, right above the pupils. You can massage over here. You can also place the palm of your free hand on the person's chest and adjust your breathing to their breathing. So you can breathe in together. So sync your breath. And you can also try to bring their attention back by saying something into their ear, because the person might, it's not guaranteed, but the person might still hear what you are saying. So just with a firm, clear, calm voice, you can tell something that can trigger their emotions and strong emotions. Either sometimes it's also recommended to trigger negative emotions, so kind of a fear as well, because we just need to bring the consciousness of a person, because in this state the person is unconscious. You can bring a strong fact about the event or what just happened, or what you need to do, for example, so to shock the person as well. The next is the tremor. Will require the psychological first aid. And how you can recognize the tremor is that the whole body, or maybe just the hands, will be trembling extremely, that the person is not able to hold a glass of water or a phone or a pen, even a cigarette if the person is smoking. So you will notice. And this reaction can last for a few hours even. And however, it is important to understand the difference between the tremor and when the person is cold, or the tremor when the person is under the shock due to traumatic event. So when a person is cold, then definitely we need to warm the person up. However, if the person is experiencing the tremor due to the extreme fear, due to the traumatic event, then first of all, you do not hug a person or hold them close. Do not try to warm them, do not try to cover them with something, because their tremor is not because they are cold. And avoid calming the person by speaking to them and telling them, pull yourself together, compose yourself, man up. get back the control over your reactions. So avoid saying so. Instead, what you need to do, you need to even make this tremor more intense. So what you can do is to, grab shoulders of a person and shake them firmly. Usually it takes 10-15 seconds to shake the tremor off. And while you're shaking, explain the person why you're doing this. For example, I'm shaking, you're experiencing the tremor, I'm shaking the tremor off so that you can feel more calm and shake off this stress. And after the tremor stops, you can let the individual to rest, and ideally they should be able to fall asleep. In case it happens somewhere at workplace, for example, it's better to get to know the emergency number, connect with their family and friends, and ask them to transport the person home. However, make sure that people do not leave the person alone without monitoring them. Next is agitation, and you will identify that it is agitation because the person will be unnaturally loud. So it's very uncommon to them, and their speech will be so fast, and they will be using their hands and the gestures and the postures, like theatrical postures, and they will keep talking without pausing themselves. And sometimes they will even do not respond to whatever someone is saying. They will ignore the commands or requests or inquiries, and they will just keep talking with loud voice and a lot of gestures. When the person is agitated, first of all, do not argue or quarrel with this person, and use direct aggression towards them. For example, hitting a person, grabbing their hand, asking questions, especially blaming questions. Why are you so? Why are you so? Avoid doing so. The first quick action that you have to take is isolate them as soon as possible, quick as possible. Ask direct instruction, follow me, let's go, let's get somewhere else. And you can also try to get some help from someone else, and ensure that as few people as possible are around to observe your next actions. However, do not stay alone with such person. It might be dangerous, and additionally, it is helpful to get help from someone else in this situation, because different individuals, they react differently to someone else. So sometimes if you are shorter on the height, you can bring someone who is taller as well, because of the physical features differences that may trigger different reactions. So give the person a chance to release their tension, and the very good technique is by letting them freely speak whatever they have. So listen, and additionally, it would be great to give them some physical activity, some physical task. For example, when you bring them to a room or a meeting, ask them, okay, move the chair, bring the chair, move this table. They won't understand why, but they might. There is a big chance that they will follow your instruction, and it will help them to release a little bit of this feeling of stress. Show kindness and friendliness, even if you disagree. Instead of blaming them, what's wrong with you? Why are you this like that? Why can't you be just quiet? Express your observation. This is the technique where you can label label their emotions. Instead, those are the actions that you need to take quickly, immediately. First of all, isolate the individual and make sure that as few people as possible are nearby and observing the scene. And sure that you're also not staying alone though with the person. So take the person to a different room, for example, different dinner, and take someone with you, because individuals differently to different individuals, and as well as it might be dangerous for you. So give the person a chance to release the tension, listen to them and let them take what they need to say out. And as well as very good in this state is giving them a physical task. For example, if it is in the room, ask an individual, help me to move this table, help me to bring more chairs, take this chair. The person might not understand why you're asking that. It will create a rupture in their thinking, and additionally, by doing the physical task, it will help them to release some stress they have within. Show kindness and friendliness, even if you disagree. So instead of blaming them, what's wrong with you? Why can't you just be quiet? Express your observation in technique of labeling the emotions. Very upset, feel like breaking everything. Maybe we can try to find a way out of this together. Additionally, when you demonstrate that they won't have or bear any punishment, they will feel more safe to calm down. Hysteria could be similar to agitation. The only thing the hysteria is accompanied by extreme laughter or crying. And as well as the person will be very emotional and talking non-stop, ignoring any comments, and sometimes either they are crying loudly or they are laughing loudly. Do not indulge the individual wishes. Remember the ethics that we reviewed at the beginning. So we are not encouraging, okay, I will give you this, I will buy you that, just to calm down. So we do not want to reinforce hysteria and stress reaction, and knowing that this type of the behavior will lead to the positive outcome or gaining any rewards from that. So because during the hysteria, a person will say, oh, I need this, if you can give me that, or you can give me that, I will feel much better. So do not provide any materialistic reward. Instead, what you need to do is similar to agitation, isolate the individual, make sure there are as few people as possible are nearby and observing this scene, and bring them to a calm environment. If you feel like it's safe for you to stay in one-on-one with the person, you can. Just in case, it's also recommended to take someone with you. If you need to capture their attention in order to shift their attention, in this example, you can throw papers, but ideally you can throw the glass on the floor, glass with the water. So we need to shift their attention, but it has to be something extreme. Importantly, we do not slap the person, okay? Confidently using short and clear phrases. For example, with me, follow me, drink some water, wash your face. Short, concise phrases. After they experience the hysteria, they calm down, they will usually feel tired and fatigue, ideally to let the person lie down, either on the floor, if there are different settings. So allow the person to lie down and monitor their condition until either professional arrives or their friends or family, and ask them to make sure that the person is monitored and not left alone. Next one is crying. It's different to hysteria because there will be no signs of agitation or, for example, a loud speech non-stop. So they won't have it, and they won't have the tensed muscle on the face. They might have some trembling on the lips. However, it's different to tremor or trembling due to tremor, because in tremor, the whole body, more parts will be trembling, not just the lips. During the cry, the person might be crying non-stop, or a person might hold back on crying. Instead, you will see that the eyes are watery. So in this case, what you would not do is say you are a man, you are strong, or don't cry, or you can bear everything. Avoid asking question what happened, and avoid giving the advice or suggestion to what happened. And not promise what you can't guarantee. For example, don't cry, everything will be fine, because we can't guarantee it. Remember about the ethics we reviewed at the beginning of the video. Instead, what you need to do is make sure that the person doesn't harm themselves or others. So remove any potential dangerous objects from reach, and take the person to a quiet place, private place, separate corner if there is no separate room, and do not leave them alone. This is very important. Speak to them in a calm voice and just listen. And regardless of whether they agree agree, just acknowledge and validate what they are feeling and just listen what they say. Demonstrate through nodding, yes, I see, I can understand, I can imagine. And as well as it is necessary to call a professional, psychologist, for example, or if not the professional, then you can call their friends or family and ask them to take care of the person, come over and make sure that they do not leave the person alone. And you can recommend them to take the person to a hospital. It could be even a doctor. To provide first psychological aid effectively, you need to stay calm and resourceful. So provide psychological first aid only when you are emotionally stable, right? And remain calm. Do not speak about the feelings, because during the extreme stress responses during the crisis or traumatic event, the logical brain is disconnected, and your goal when providing psychological first aid to connect this rational brain and rational thinking, logical thinking. You need to avoid saying everything will be okay. It will pass. Life will get better. Once again, we link and we refer to the ethics of providing psychological first aid. We can't promise what we can't guarantee. Adjust your tone and pace and slow down your speech. You should ideally speak much slower than usually. Give short and direct instructions. Look at me. Can you see me? Come with me. Do as I do. Drink water. Wash your face. Follow me. Then normalize whatever they are feeling or experiencing. And those are the most effective phrases by normalizing their stress responses. All of your reactions are valid. It is a normal reaction to an adverse situation or an event. I see you are anxious. I see you are nervous. I see you are angry. I see you are frustrated. Because any kind of stress response is normal, because when there is a traumatic event like natural disaster, death of someone else, accident is happen, it's absolutely normal that an individual will experience an extreme response to such a great stress. If it is a stranger, then first thing you need to do is introduce yourself. Be short. My name is Yuliia. I work at Driven Properties, as an example. Do not say you are trained to provide the psychological first aid or you have any psychological or clinical background. If you do, ask their name quickly. What's your name? Where are you from? And try to ask the questions that to bring them out of the context of the situation of what just happened. For example, where do you work? What's your role? What do you do for work, right? Another technique is what you can do to quickly bring the person into a resourceful state. It is called 5-4-3-2-1. It is meant to activate all of their senses and connect the emotional brain with the physical body. First of all, you need to start with taking 10 deep breaths and hold the breath in between. Then ask them to name 5 objects, what they see around. Ask them to name 4 sounds they hear. Ask them to touch 3 objects and describe their shape. Name 1 feeling in their mouth. So you activate and connect all of the 5 senses. The perfect implementation or application of this technique, if when you start doing it immediately in the conversation. For example, hello, my name is Yuliia. I am a trainer at Driven Properties. What's your name? Where do you work? What's your role? And I will start taking a deep breath and asking them to do as I do. And I start breathing. Tell me, what do you see around? Can you see the chair? Okay, what else can you see around? Can you see my fingers? Okay, well, what else? Can you see the table? Can you see the people? What else can you see? What can you see in this window? Tell me, what do you see? Perfect. Tell me more about, can you hear? Can you hear the sound? Can you hear my voice? Can you hear me clearly? Okay, perfect. What else can you hear? What's going around? Okay, good, perfect. And I see that you have a nice t-shirt, by the way. Does it feel soft? Right. And how about the temperature in the room? How about the temperature outdoors? Okay, is it hot or cold? Does the temperature feels right? Right, good. I can smell nice perfume. So have you applied the perfume today? Okay, what's your favorite perfume? What else can you smell in the room? Okay, do you like the smell of this room? Yeah, so this is the fragrance that we are using. I love it too. So cool. Tell me, how about your mouth? Do you feel thirsty? Is your mouth dry or not? This is just a quick example of how you can apply this technique without telling them that you are doing this technique. That would be a very good application to make it conversational. The next technique that you can do is to bring them back into the nice, happy memories. Bring them into the memories where they felt resourceful. You can ask, have you been on a vacation already this summer? Okay, what's your favorite destination for vacation? Yeah, what did you do there? Or tell me more about what do you do apart from work? What do you do for fun? What's your hobby? How does it like? How do you play? For example, paddle. Oh, nice. Tell me more about how do you play paddle? How long have you been playing paddle? So carry on bringing their memories, nice memories when they were in a good mood, good state of mind. It will help them to bring back their resources. Questions to avoid: asking about the event or what just happened. It is causing them to re-experience the same stress and shock that they have just experienced. Avoid complaining. For example, yeah, the situation was so bad. I also was stressed, and I couldn't fall asleep last night, and I was thinking, and my family and my parents and my friends. Avoid sharing the negative experience that you had as well. Avoid calling them different name. So at the beginning they gave you the name, and use the exact name that what they said, because we don't know their background. We don't know what a different name might trigger. So use the name that they gave you at the beginning of the conversation. And avoid asking them about their family, about their friends, because again, we don't know what's the background or what's the story behind. Lastly, if you or someone of your close ones need help, in the UAE there is one non-profit center called Amal Council. They provide the psychological help or mental health help for free or at a very low cost to any community, any individuals in the country. And additionally, you can reach out to me via email. Here is my email, yuliia@drivenproperties.com. And I'm here for you. Thank you.